Hi guys, welcome back to Rts Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everybody. Welcome to anybody new. Thank you for those who voted for the tagline. Apparently, everybody likes the old tagline versus the new one, and the new one was where respiratory therapists use their outside voices. So apparently nobody liked that one. So we're going to stick to living out loud. Okay. So thank you. But today I'm excited because I have another guest co-host and she does amazing things in the ECMO space. So we are really excited about that because I don't know too many people that do that as a respiratory therapist. So super cool. And we follow each other on LinkedIn and in the social media space. But before I let her do her thing, I'm going to introduce her accolades. And yeah, you guys know how I am. Hopefully I get it right. I'm grateful that she has an easy name. So yes, Kimberly, I'm pulling you up right now. Kimberly Smith is an ECMO specialist, received her Bachelor's of Science degree from Salisbury University in 1994. She started her career at the University of Maryland Medical Center, finding success and enjoyment in the NICU and PICU settings. In 2021, Smith transferred to Johns Hopkins Hospital and has remained there since now. She also expanded her career in 2010 to become an adjunct faculty teaching clinicals at Baltimore City Community College, while she impacted the future of the profession by teaching the fundamentals of respiratory principles. In addition to taking participation in the AARC and MBRC, she serves as a board member for the Maryland and DC Society of Respiratory Care. She was recently elected delegate of the state of Maryland for the MDDC. Yes, Kimberly, you are busy. You got some accolades on you, girl. Well, yes, thank you, everyone. Welcome, Kimberly. We're so happy to have you on Rts Share Tea. Thank you for being a guest co-host. So,
thank you for having
me. Yes. I'm glad to have you. So, you know what? So let's just jump right in. And we all know we have the story of what got us into respiratory. So I gotta ask, what got you into the profession?
So I started out as a biology major at Salisbury, and I started within the first 2 years. I decided that I didn't want to be in school as long, and so I began to look for another career that will allow me to be able to help people, because that was my main goal. Like initially I wanted to be a doctor so I can help people, but then I wasn't down for all the schooling that was required.
Right.
So we had a good nursing program, but I came across respiratory at Salisbury in like 1992. I started the program there and just fell in love with being able to come out and be able to make a difference in patients' lives and help people.
Nice. I know I think I have yet to hear someone say like they started out knowing what a respiratory therapist was and they were like, yeah, I went to school for that because I knew what that was. So that's why it's always interesting to hear like, how did you find it? Like who told you it's a secret? And so yes, well, thank you, Kimberly, for sharing that with me. And okay, so you went to be a respiratory therapist, and what made you say like, okay, ECMO is where I want to be, or this is what I want to do? And can you break down for those of us that don't know what ECMO is exactly? Can you break that down, what that is and what it looked like to be a specialist in that?
Okay. So when I came out of school, I started at University of Maryland. They did not have an ECMO program there. I transitioned in 2001 to Johns Hopkins, and there they had there were so many opportunities to advance my career. And so in 2003, that's when I took the ECMO training. And for those who don't know what ECMO is, ECMO is advanced mechanical life support that is used for refractory hypoxemia. So we all know that in high ventilator settings can be toxic to the lungs. Mm-hmm. And so what was happening is we saw a bunch of people needing more support than was safe. So ECMO is just a form of oxygenation and ventilation mechanically that is where the blood is ran outside of the body and through a special pump where it can receive oxygen and CO2 is swept off, and then it enters back into the body. It is a very complex system,
yes,
but in 25 words or less, that's what it is. And so at Hopkins, you had to be trained for that. You took a 2-week-long class, and then you had to.
I'm sorry, Kimberly, I missed it. How long is the class?
2 weeks.
2 weeks. Oh,
2 weeks. Yeah. So you did 2 weeks of training, like you did some wet labs, and you did a lot of lectures, and then afterwards you were required to take a test. And then even in addition to that, you had to have 72 hours of buddy sits before you were signed off and deemed proficient as an ECMO specialist.
Wow. Okay. Oh, cool. And so can you walk me through, so what does a day in the life of a ECMO specialist look like? Like what does your assignment look like?
Oh, okay. So when I'm ECMO assigned, I only have that one patient because you're doing checks every hour. You're responsible for watching changes in the monitors on the screen. Okay. So that patient has your undivided attention. And even on that particular day, even though I'm trained as a respiratory therapist, there is a respiratory therapist that managed the event. So my main focus is ECMO. And I will say this, every day when I go into work, I am not assigned. We have people that do ECMO. We have like ECMO specialists that do it most of the time. But when I either sign up, I have just the one patient. When I'm acting as a respiratory therapist, I have a number of different patients.
Okay, so, okay. No, this is very interesting because I always was trying to wonder, like, how do they break up the assignment, or how long are you with a patient? And how long is your average patient on that type of equipment, like, that whole ECMO system?
So the quicker you can get them off, the better. ECMO, you only can be on it for a max of 30 days. However, we have had cases where patients have been on longer, and there was a patient that was on a form of ECMO for over 300 days and survived. I can't say her name because of HIPAA.
Oh, yeah, of course. Yeah. Wow.
It still works.
Wow. Over and made it. Wow.
Yes, it made it. Yes.
That's impressive. Okay. Yeah. Okay. That is very good to know. I'm eating this up because I didn't even know all of that. Like I wanted to know, like, what is the standard of how long can they be on ECMO, and I guess the mortality rate of them making it, if.
So when you go on ECMO, it is a risk benefit. Obviously, when you're on any type of machine that involves running blood out of the body, you have to be on heparin. And when you're on heparin, you have several different risks that you're faced with. You have the risk of a head bleed, your risk of excessive bleeding. Right. So when the doctors make the decision to put a patient on ECMO, they weigh the risk versus the benefits. And they make the decision to activate ECMO with the thought in mind, we're going to be on ECMO as short as possible. And then mainly for the main reason of resting the heart, resting the lungs so they can recover and get better.
Wow. To me, it's so incredible to hear someone that actually works with ECMO, because like I said, I think when I experienced it in school, I seen it through rotation, just, rotating through different hospitals as a student. And I just remember it being one just being an intimidating piece of equipment to see blood coming out, and just because I've done oscillator, jet, nitric, just thinking of all those things, but to be ECMO was always the most, it just looked so complicated to have to manage it. So it's just good to hear, like, you take your training, and that you can be dedicated to that one patient, and just managing their condition, and the machine.
Yeah.
Yeah.
And so in addition to that training, you get annual training 3 to 4 times a year. We have educational updates where you get to do some hands-on. Oftentimes you are retested on skills. We have, sometimes there are periods when you don't have patients on ECMO, so they, it used to be a requirement that you set for 100 hours, but there are times when we have so many ECMO specialists and not enough patients.
Really?
We have been trying to, we have gotten away from that, and now we have just like wet runs or proficiency tests to check your skills.
Yeah. Okay. And let me know, and this is for my FYI, did things change drastically during COVID in regards to
ECMO? No. So I didn't. So I work in the pediatric area, so we didn't have much. We didn't have as much of an impact as you see in the adult world. I will say this, when I had to rotate as a respiratory therapist onto the adult side during the pandemic, there were several patients that I've seen on ECMO in the adult setting. At where I worked at Hopkins, the adult ECMO was separate. It was ran by perfusion. And then on the pediatric side, we did the bulk of the ECMO patients, but we didn't see a large uptick in cases during COVID.
Okay, all right. Well, good to know. Good to know. Okay, so what were, if any, barriers did you have, like, starting to go down this career path, this specialty?
So,
if there were any barriers?
There weren't any barriers. Again, like it is, you continue to learn as you go daily, and it's such a complex system. I would often just keep reiterating how it's a life and death situation, and so I always, when I'm teaching students too, I'm saying you have to be present for your patient, paying attention, engaged, because things change from minute to minute. And, you learn from things day to day. I mean, things can change within a minute with an ECMO patient. So you have to be focused and engaged and present for your patient with ECMO as well as any other. But especially with ECMO, because things can go downhill so fast and so rapidly. And then we also know with children, they can rapidly decline. Anyway,
I was just about to say that. Yeah, especially
children.
And you basically answered the next question, which was, what would you tell, students, or what would you tell somebody that's interested in something like that? Because it does seem, based on what you're saying, it does seem like the person, whoever's interested, needs to be like a lifelong learner, somebody that likes to learn, and they got to keep up with their competencies, and they got to be on their toes, like that type of. I mean, in respiratory in general, we already like that, but I feel like that's what you're basically saying.
Yeah, because if you think about it, is respiratory, whatever career, whatever path, if you want to be NICU, PICU, ECMO, whichever path you go in requires a lot. I mean, constant learning. You have to be able to, separate your personal life from, like you're here at work, you can't be worried about what's going on at home. Right. Sometimes it's hard even for women to separate. And so the advice I would give to anyone that is looking to be an ECMO specialist is maybe take time, do a buddy day with someone, and kind of observe how involved and intense things can be, and reiterate how important it is to make sure that it's something that you want to do and that you'll be able to do successfully. Excuse me.
No, this is good. Some good gems. Because like I said, I don't know how many people interact with ECMO, but I know that it is just interesting just to hear someone that deals with it, on a daily or as part of work. So yes, this is really, really, really good. And and like I said, you answered my questions, and hopefully someone watches this and they're just like, oh, okay, maybe, this is something I would be interested in as a respiratory therapist. If they feel like, okay, they're in a acute care and they're just looking for something else, something new that they can consider, something like that. So thank you so much, Kimberly, for sharing that. Your perspective on that stuff. And well, this is your opportunity to plug anything that you're doing. Let us know where to reach you, what's new with you, what's going on, what you got going on.
I'm just starting out as a representative for the Maryland and DC Society of Respiratory Care. And I just wanted to take a delegate, excuse me, for the Respiratory Care Society. And so I just want to take a minute to plug Luminous Health's annual Spring Tune-Up Respiratory Conference, which will be April the 21st from 9 to 3 in Annapolis, Maryland. Lenny is the director, Lenny Agundo. I believe he was a guest of yours.
Yes, yeah, I like Lenny.
Yeah, and so he always puts on a very detailed conference. And so for those who are looking for CEUs, I know it's not a CEU year, but it's always a good opportunity to learn and network with different colleagues in Annapolis, Maryland. Yep.
Tell Lenny to hit me up, maybe.
Okay, I will.
You know what I'll do? Give me the info. I'll put it in the description. I'll put it in.
Okay. I'll send you an email with the description.
So, and how many CEUs it comes with?
You get 6 CEUs.
6. Okay, cool. So, and okay, so yeah, you could I'll put it in the description, and tell Lenny to holler at me.
Okay. And then I have another one of my colleagues and friends at University of Maryland Medical Systems. They are doing their cutting edge conference next week, March the 24th. Also 6 CEUs, and they also have breakout sessions for pediatrics and adults.
Okay. All right, cool. Okay, so you guys, y'all busy.
Maryland, we trying to come back post-COVID. We trying to have some in-person conferences.
I know everybody, but you know what? I'm not mad at it. It's time. It's like how many of these Zoom things can we do? I mean, it's just like I like the hybrid options. I like when it's like, okay, because there are times when you genuinely cannot get out. You really just can't. The scheduling. But it's time. I want to meet people in person now. I'm there. So yeah. Any opportunity where we can have that is amazing. So that's it. You good?
That's it. Yeah.
Okay, Kimberly. Well, Kimberly, you done plugged. And I appreciate you. Thank you so much again for being a guest co-host on Rts Share Tea. This has been amazing. And I'm just going to put everything in the description, and how folks can contact you if they interested in what you do. And yes, guys, thank you so much for being here with me again. And I just wanted to remind you guys, more CEUs on. We have the RT Navigator on Wednesday, April 12th, 2023. If you need those that are interested in asthma education, getting CEUs in that, I will be speaking on asthma devices and patient education, and I'll put the description for that as well. So come get these CEUs. This is the year to invest in yourself. You hear Kimberly speaking, you hear me speaking. We're all unicorns in our respected fields of choice. So come join us. All right, guys. So, and remember, Rts Share Tea is here every Wednesday on Google Podcasts and most podcast platforms, and we on YouTube every Thursday. So look out for us, guys. We are growing together. And I will see you next week. Remember to invest in yourself and to only compete with yesterday's version of you. All right, guys.